Hi, my name is Diego Carrion. I am a medicine student from Universidad de Monterrey in Mexico. I am the founder of Future Education, and this is the video for the SBC. So what will we do at Future Education? We deliver and we try to develop soft skills in young professionals. We focus in health students, such as medicine, nurses, lab technicians, biomedics, etc. And well, as you may know, we are also stuck at home due to the pandemic of coronavirus. So it's really difficult for us to portray in an animation what we do in our prototype. So I'm gonna tell you one of the typical cases we use in a workshop based on empathy. So I'm gonna tell you a bit of story. I met a girl named Mary about 2 years ago when I was working in a hospital in Mexico City. She had cancer, leukemia, that is cancer on the blood. And she had been going under chemo treatment. She had already entered in a phase of disease that is called remission. That it means that she had no signs nor symptoms, but still had some cancer cells inside her. And for all of you who have combined or have someone close with cancer, unfortunately we all know what chemo does to the body. Loss of hair, loss of appetite, vomiting, nausea, and pain, among many other factors that can happen. She suddenly stopped coming with her parents at the hospital at some point, and she returned a couple months later with the cancer completely, fully back on. We asked the parents what happened, and they told us that somebody recommended a remedy, natural remedy, instead of the therapies, and they decided to stop going to chemo and start giving this remedy to her daughter. Unfortunately, I did not have the outcome since I returned to Monterrey before knowing what happened to her. But this is a typical case we usually found in any hospital around Mexico and probably around the world. Patients saying no to treatment and going into more natural alternatives and completely discontinuing the treatment that is trying to save their lives. So what we do in these workshops, we are based in two main axes: educational experience and facilitation. So we try to talk to each of the participants, or well, to make them discuss into groups and discuss as a whole group depending on the amount of people we are working with. What do they think? Who made a mistake? Maybe it was the parents, and for example, I know that a lot of you may be like right now enraged about the parents, like how could you stop going to chemos and just gave her some natural remedy that somebody recommended. But we have to understand that the pain of having a child in chemo and seeing her in pain every day, it must be completely underwhelming. So we try to discuss what happened to the parents, what happened to the doctors, what could be improved, and we end with a simple question like, if you were a physician that was treating her, and if you had the chance when the parents come to you and say like, hey, we heard about this natural remedy, what would you do? How would you address the issue without them making them feel bad, making them feel like they don't know nothing, and maintaining this good patient-doctor relationship? We notice that academia is focusing a lot in the knowledge we need as doctors in an academic ambit. So how to diagnose, how to treat, how to prevent. And unfortunately, we are missing a lot of the human part that is as important as the technical part of being someone in the health professionals. We address this issue and we develop these workshops and these programs that focus in skills like empathy or active listening or effective communication, even teamwork between physicians, etc. We do this because we believe that it is as important as the knowledge of how to treat a patient. It is as important as the knowledge of when to treat it. How we address the patients, how we talk to them, and how we guide them through the process has a lot of repercussion in how they take the treatment in time and how their outcomes improve. This is like the prototype of what we do. It's basically one of the facilitators just talking to the audience, so it's not really that far from this video as you may think. And I hope that you like it. Of course, we cannot like do the entire process because it will take you about 15, 20 minutes per case. But usually this is what we do. We present a case, we analyze it, and we try to break it into little pieces so they know what they can do and the situations they will be facing soon when they become physicians. I hope that you like it. This is what we're doing, both virtually, both physically, and we really hope we are going to change the medical education, the health education. We are going to improve it, and we're going to help to make better doctor-patient relationships. Thank you so much.